Guys.
Hi, V.
Hello.
Yay. Hey, Facebook. Talks with the Task Force, Friday nights at 5:56 because millennials like being on time. I am so excited about tonight's discussion. It's very different. We're joined by two lovely guests. We don't normally do two guests, so this is double the fun. I have here with me John Warning from H.A.S, as well as Frida Enriquez from H.A.S. I'm going to let them introduce themselves because they're just that great. John, tell the people who you are. They know that I'm V, the communications director with the Westside Heroin and Opioid Task Force. So who are you?
I am the lead harm reduction coordinator here at Healthcare Alternative Systems, or H.A.S. So I run the program that does like naloxone distribution and overdose prevention here at H.A.S.
Excellent. And we have Frida on our Zoom today. What's up, Frida?
Hi, so my name's Frida, and I'm the harm reduction coordinator here. So I'm really, really happy to be here and sharing this space with you all.
Yeah. Thanks for having us.
So guys, what is H.A.S? Healthcare Alternative Systems. Tell me what it is and what you guys do.
Yeah. So H.A.S is actually a pretty big agency. It's a treatment facility program for folks who might have like a substance use disorder. So we have a number of different programs for folks who are seeking treatment. So we have, for example, 2 residency programs. We have a 28-day residency program and a 6-month transitional living program. And then we do a number of different outpatient and intensive outpatient care for folks. And we have a methadone clinic. So definitely part of the MAT in Chicago, and then some mental health. We do mental health service programming and domestic violence prevention programming. So yeah, H.A.S does a lot of stuff.
I see. That's impressive. Tell me, during COVID, did you guys close at all, or?
COVID was, we had to adapt for sure, like everything else, but we were essential workers. So we stayed open. We moved a lot of those services over to telehealth, especially like the outpatient and intensive outpatient programming.
Okay.
But as far as like our residency programs, we were still seeing folks. People were housed in those programs. As far as this, our program, the harm reduction program, we kept doing what we do. So we were trying to get naloxone to people who needed it. And one of the realities of the situation with COVID is, the overdose numbers have gotten more grim in Chicago. So in that sense, we stayed really busy, unfortunately.
So John, how did COVID impact overdoses? Did you guys notice a surge at all?
Yeah.
Wow.
Yeah, overdose numbers in Chicago have skyrocketed in part due to COVID. There's some evidence that they were on the rise a little bit from 2019, but COVID made it harder for a lot of reasons. It shuttered social service programs. It made people who are used to kind of a street market to access their drug of choice. That made it much harder. But also practices that are good for prevention for OD are counterintuitive for stopping the spread of COVID, right? So like we have to isolate or socially distance, and we actually need people to be around each other to administer, let's say, like naloxone. So all of those things and a lot more made overdose rates very high in Chicago.
You keep saying this naloxone word. What is that?
Yeah. Did you say what's naloxone?
What's naloxone?
Naloxone is the antidote for an opioid overdose. So if a person has taken an amount of opioids that have repressed their respiratory system, so they stop breathing, we can inject them with a dose of naloxone and it'll reverse that.
So that brings them back to life?
Yeah. Yeah,
Wow.
it restores breathing function, and you need to breathe to stay alive. So yeah, so it brings them back to life.
And
Wow.
that's one of the reasons why we do naloxone training for a lot of folks, just because we want to teach people how to use it correctly, and
Mhm.
it's all within time.
Yeah,
So something John has taught me time and time before is that time's against us when it comes to all of this, and we want to act accordingly. So when we're training people properly, we're not only training people that are staff, we're also training people out in the streets. We're making sure that they know how to properly use it, so that it's effective for the people that are using it.
Yeah.
absolutely. Yeah.
So what does training people look like? Are you doing that virtually? Are you going to people's homes? How are you training people?
Yeah, yeah. I mean, whatever. I mean, we would, as long as people are comfortable. I mean, we would do a variety of different trainings. I think the bulk of what we're doing, especially for folks outside of our like H.A.S's network, we are doing those more in a virtual forum. So lots of Zoom meetings for agencies, and that's totally understandable. But like we still have done some one-on-one trainings and that, or some smaller group trainings, and just with social distancing, and appropriate PPE, face masks, maybe gloves.
Mhm.
We've been able to provide those services still as well.
Really good. Are people receptive to that virtual type of idea?
Yeah, I think some aspects are a little more difficult, right? So like we
Right.
really like the training people and giving them an opportunity to practice. So we have them handle an intramuscular syringe, for example. Practice shooting somebody with a dose of naloxone on like a stress ball, and so you lose that side. But other than that, it's still a really good informational piece. And there's a lot of context that we give in
Mhm.
that training that people really respond well to.
Good. Talk to me a little bit about the disparities in the communities, Frida. Is it easy for people of color to access Narcan and naloxone trainings and to access treatment?
Yeah, it's really hard, and it's just mirrored with like our healthcare system. There's not a lot of access for people of color. There's just it's just immense of the gap that's created, and more so with something so stigmatized as drug use. So it is really really hard for folks to get all the information. So yeah, it can be really really difficult for people to access just even information, and even more so materials to do things as in a safer form.
Yeah,
Is it
well said.
safe to say that so many people are struggling with overdose because there's a lack of resources and assistance and help?
Yeah, and then also it's just who it's directed for. So one of the things that I like focusing on is the Hispanic community and the Latinx community, and also
Mhm.
it's that barrier, which are a lot of barriers. It can be language barriers, it can be barriers on their legal status, it can be so many things, and it's just layer upon layer upon layer that people just have to get through. So it's not even that maybe the services aren't around them, it's also that they have so many other things that are weighed against them when it comes to them accessing just basic needs.
Yeah.
Yeah.
So the barrier of being legal, can we talk about that a little bit? Tell
Yeah.
me what that means.
Yeah, with immigration and with someone's legal status, it has to do a lot with the service that they can receive, because in a lot of places people are asked for healthcare insurance and with their social security number, and it's just added information, and also it's just the insecurity of people that aren't able to they don't even go to as far as even asking for these services because they're scared that there might be repercussions if it comes out what their legal status is. And we even in the past months and in the last year, there have been a lot of ICE raids, and it's just all of these things that just keep a lot of people from stopping them from getting all of these resources that might be available even though they're scarce.
Wow. So, worst case scenario, if someone isn't legal and they need this help, and they try to jump through hoops, that could actually cost them being here in this country, you think?
It really does vary. It's just there is a huge thing in the Hispanic and Latinx community with someone's legal status, where it's like, will my information be provided to a third party, with who and how? Because that is where the question is, because it might not be from the people they're receiving those services from, but who it's shared with. And that's why there's a lot of distrust with the government, and also with, you know, things like the prison system and things like that. We know that a lot of people of color are the ones that are in these places. So there's just so many things that unfortunately are pent up against people in these situations.
It sounds like it. So I'll tell you, just working with the West Side being predominantly Black, and I think that's the case. Don't quote me, because there may be new numbers, but I know Austin is one of the largest neighborhoods in the state, and that's predominantly Black. So that's my figuring. Is it the case that sometimes disparities in the Latinx community is looked over?
Yeah, a lot of times they're brushed under POC, so people of color, and we're not as broad as we should be with our statistics. And a lot of things are just bridged under a certain section when they should be catered to specifically. But yeah, a lot of our communities, a lot of the Black and brown communities are definitely mixed, or we're right next to each other. We're neighboring, just because we know how segregated Chicago is, to be a little bit more specific.
Right. So H.A.S loves everybody, because H.A.S wants to save everybody. And so you all have this new program that I think is really cool. And Frida, I want you to talk more about it. But it caters specifically to the Latinx community dealing with overdose and harm reduction. Talk to me a little bit about this program.
Yeah, so one of the key things of why this is just so important is because if services are available, they may not be available in Spanish. And when it is available, it's just roughly translated, and that is, you won't be giving the best service you can when you're just translating it without knowing the community. So when we're talking about substance use, we want to broaden it up. There are a lot of different substances that people use, and it also varies by location, it varies by race, it varies by all of these other things that people are exposed to in their community. So when we're just expecting to translate something, let's say, and it's going to adapt and people have to assimilate, which is something that is really, really big in the community where we're coming from, another country or anything else, is just people are expected to, hey, if this works for one person, it has to work for you. But that's unfortunately not the case.
Yeah.
So that is one, sorry, that is one of the reasons why it's really important for us to, when we're gonna do the work and we're gonna do it right, which is catering to the Hispanic and Latinx community, is we wanna make sure that we are seeking to their specific needs, and we're not telling them what they need. We're actually wanting to ask them, wanting to meet them where they're at, so that we're like, hey, we understand there's a need, but tell us specifically how we can cater to you. We're not here just to tell you, hey, this is already something that's established. It has to work for you.
And I think that's especially really important for like harm reduction programs in particular, because I mean, at the basis, harm reduction is all about working with people and helping them identify what works best for them. But if we're not engaging at all, like appropriately, or having that client-centered approach to the communities, then we've already lost the battle.
So then how do you meet them where they are exactly? What neighborhoods are we talking about firstly? Name some. What neighborhoods?
Oh, there's a lot. There's a lot of great communities, like we were mentioning. There's a lot of integrated communities, but the Hispanic Latinx community, you may be able to find them a lot on the west side, whether it's northwest, southwest, or just west loop, like Kelson or Little Village, which are mostly the predominantly known neighborhoods for Hispanic communities. But there's McKinley Park, there's Brighton Park, there's Archer Heights, there's all of these other areas in the neighborhood that
Mhm.
that are Hispanic based.
So then in the Hispanic community, with these disparities, what about the young folks? I always think about the youth, it's so much stigma with getting help, especially drug addiction and harm reduction type of help. How then do we relate this to helping people through that stigma?
Yeah, and it's sort of a different type of stigma that's also carried.
Mhm.
It's always layered with, I feel like with minorities, which is, it's like, it's not only what we have to deal with society, we also
Sure.
have to work with what our culture is and what our
Yeah.
parents, how they were raised and how they see things and through their lens, because of course that passes on through us, and that's something that we carry. So yeah, there's so many perspectives onto how it might be seen with their friends, but also how different it might be when they're speaking about it with their family members. But yeah, it is a topic that is very stigmatized in the community, because a lot of the times we don't have the proper information, we don't have the proper tools to help people out, which is something that is just really, really necessary.
John, how do you encourage people to kind of get beyond that stigma that, oh my God, I'm a user and I need help, but I don't want anyone to know? How do you encourage people on a day-to-day to get through that?
I think the best is human connection, to be honest with you, and providing, affirming education, so people. It's funny, people do better when they have a sense of community, and people do, behavior change is a lot easier when they have support from people, and drug use and the stigma that's associated with it is so isolating. And you are constantly, as a person who used drugs, is you're othered, by what, just by using drugs, and then tack on all the other like systemic oppression that comes with it. So I mean, I think being there, and then of course, if we have the ability to make tailored and specific interventions for people, we should try our hardest and take the resources that we can to make adequate and representative programming.
Absolutely. Frida, do you worry that even with a program like this, it'll still be difficult to penetrate the Latinx community?
It's difficult to say. But really the answer is yes. There's just so many things we have to do. Building trust in a community is really, really big.
So let's stop there. That's a great point. Thank you for saying that. I do a lot of culture writing for the African American community, and I see that building trust is very difficult in terms of Black America, especially with millennials in our age bracket, with law enforcement, the media. I mean, every time I talk to a source, it's I don't trust the police. I don't trust the city officials to provide quality health care. What's the trust issues in the Latinx community like?
It can be a lot of the same trust issues that the African American community has, but it might be seen in a little bit different in some other ways, of course. But it translates. It translates overall, because we know that as many people get stopped just because their car looks a certain way because of the color of the skin of the person that's driving it. So there are just so many things and so many barriers that are placed in that way, where it just makes it a lot harder for people.
John, why do people turn to drugs?
For any reason that you can come up with. I think that, drug use is impossibly complicated. And it could be, it could be for pleasure. It could be to you know, to numb pain, you know, to help people cope with trauma. I mean, it's anything really, and that's the reason why people use drugs, I think. And I think from a harm reduction perspective, we are trying to make it more complicated. I think people try to make it black and white, right? Like, you use drugs, you're a bad person. You don't use drugs, you're a good person.
That's definitely true. How
It's just not true, right? Like, people, really great people use drugs, and so we have to get away from that kind of like stigma, that black and white stigma.
Yeah. And I come from a reproductive background, and a lot of times we've heard, oh, do not go and teach students about condom use. Do not teach young people about about STIs. Do not talk to them about sex because they're going to do it. But as we found out over the years, it's like, we need to talk about it. We need to give them as much information. And that's exactly it translates with drug use. Teaching people about drugs, not just telling them don't do it, say no, but telling them actually, hey, these are resources. It's just like, it really does translate with like, why are we just saying don't talk about it because it's gonna make people do it? That is not the case.
Yeah. Is that the case for like teenagers and adolescents? Is saying not doing it, telling them to do it?
Yeah. I think it turns out that, you know, or I think it's pretty consistent. We don't like directives, you know, as human beings. We really don't like being told what to do. So I think that translates really well with being like, don't do these drugs. People are like, you don't know my life. Get away from me. I'll do what I want. You know, and you know, my harm reduction is absolutely framed within like from a sexual behavioral health perspective as well, and we know that messaging just has failed for so long, and a lot of, you know, we don't want to necessarily frame it as avoidance of risk necessarily, but there are truly some health outcomes that I think people want to avoid when using drugs, but saying like don't do it is not only an inadequate way to discuss drug use, but it also adds more shame, and people just disconnect from that.
Yeah. We have a comment here on our Facebook from Raw Diva maybe. Hey, she says, I think she's saying, Frida, you said minority. What is minority about you? Nothing is minority about me and other Black and brown people that I know. I think this person is wanting you to clarify what we mean and how we're defining minorities.
Yeah. We're just, well, what I was meaning is more about population wise. It's like we are fewer in numbers. And a lot of times because that happens is we're set aside and we're just seen as like, well, now we have to adapt. We have to assimilate to what the white population is doing and what we're doing for the white population. So minorities have to get always on the bandwagon of what is resource. So kind of maybe like the opioid epidemic and how it happened, and it was because a lot of suburban white people were using it, and there were a lot of ODs, and that's what caused a lot of the attention to go to it when this was happening to a lot of people of color. So that's kind of what I meant.
I got you. Thank you for clearing that up, and thank you for your online question. Yeah. Walter Jones says, hi, Veronica, great job. Hey, Walter, we appreciate your support. He was on last time. Oh,
welcome back.
So let's talk a little bit about, you know, the way that the opioid epidemic got its attention. We've talked about that a lot on Can TV, John, and our segment. And it is interesting that when it was a white drug, it became an issue. Is it the case that the Latinx community saw it that way too, Frida?
I'm sorry, what do you mean?
Is it the case that when the crisis happened, the Latinx community was thinking what the Black community was thinking? Like, we've survived the crack epidemic and we've survived this and that. Now, all of a sudden, the opioids became a white drug and now we're going to give it attention. How did the Latinx take that? The Latinx community?
That's a really good question. I do have questions about that as well, and how it's perceived, just because a lot of things are just placed under the same list for everyone, like we were mentioning earlier. And it's just like, oh, well, this happens to white people, so this also happens to everyone else. But there's just so many other things that also happen when that goes on. So it's just like, let's talk about those as well. It's not just on that we should be placing all the focus on, because it's necessary, but there's just other things as well that we need to cap under that, because when we're talking about other people of color, we need to ensure that we're also putting a spotlight to those things as well.
I hear you. So you guys said in terms of actual harm reduction, we can't just tell folks don't use opioids, don't do it. So that sounds to me like we need to get people when they're young. Is that the case? Do we want to go into schools? Do we want to create a situation where people are learning this at school? Do you suggest that? I'm sorry, you have to go.
No worries. I mean, I would be. Frida has a lot more experience with going into school systems and doing education. I think that so. We know that drug education has happened in schools before, like the DARE program, and
yeah. Oh my God, that makes me feel so old, John. The DARE program.
I went through DARE. I think a lot of us did.
I know I did.
But I think like by like today's standard, I mean, like the DARE program wasn't a success. I mean, especially I think from the perspective of like, we're going to engage youth or young folks to not use drugs. And there's some data now that suggested that actually within that population, drug use has gone up.
Yeah.
Right. So what I mean and what I'm trying to get at is like, I would be really interested in how that information is presented in schools. And if we're doing our due diligence and a good job, it's going to be less of don't do drugs, but more of being like, hey, let's talk about what leads us to use drugs, and also what to expect from drug use, and how to stay safe and how to stay alive. And I also I don't think that type of conversation is gonna happen in school systems. I don't think schools are going to be comfortable with us going in and having that conversation quite yet.
Yeah, I hear that. So yeah, I think that the DARE campaign really dared us to do what we decided to do anyway. Most of our generation. Are you at all worried about the young Latinx community, Frida? What are your thoughts on getting them some education and support?
Yeah, like we need more education. We need more resources available to people. We need to create spaces where if they have questions, they can go in and not be judged if they're asking about something, and they shouldn't be told stop doing it or don't do it. Like they should really try to understand and meet them again where they're at, because there's more to it than just that. So spaces would be amazing to create for youth, because where they can get information on how do I speak to my parents about this? How do I speak with a friend about this? How do I do all of this? And as we were speaking up earlier, it's like sometimes people are self-medicating. Sometimes people are doing it for very, very different reasons. And we need to have spaces where, they're going to be able to come in and know that they're not going to be judged for the decisions that they're making. And that they're just that there's a space where if they have any questions, they're just going to get resources and ways for them to stay healthy as they can be, because we know that there's still so many barriers for people to receive basic dental care and basic health care and regular checkups, which is still already very hard. So like John was saying, I would love to see something like that, or would like to see how that takes place. But yeah, creating a non-judgmental space for just youth to come and ask all the questions that they have, so that they can build the best decisions for themselves, which is truly something that we always used to say when we were in schools, because we did health education in high schools, and it was predominantly on the South and West Side. And we told them, here are all the tools so that you can make the best decisions for yourself.
Yeah. It's so interesting though, because even while talking about this as 30 somethings, there's so much that's changed in the world. in terms of how young people respond to drugs, how parents respond to drug abuse. So, John, with that being said, how do we keep our lessons and our support up to date? I mean, the millennial generation, we change every day. The Gen Xers change every damn hour. How do we keep up with that in regards to harm reduction?
Yeah, I mean, it is an undertaking. I'll say that, and I think that we were there's a lot of misinformation, and it's not easy to get through, and but I think giving people as much access and to that education, to a breadth of education or information online is the best way that. One of the best ways that we can kind of tackle this, and then funding programs that can keep up that level of engagement. I think that's two of at least the best ways I can think of off the top of my head. Frida, I would love to hear if you have any other suggestions.
Yeah, no, yeah, I definitely agree with all of that.
Is there a way to educate the young people enough to not only decide not to do the drug, but also educate their peers? Like, I know that's asking for a lot.
So at some point we have to also educate our everybody about their bodies, right? Wow. Like this conversation cannot be had, like effective and safe drug use cannot be had without having like realistic, like tailored, sensitive conversations about our bodies, and we just don't do that either. So I think that without a restructuring of the framework of how we discuss these conversations, I don't know that they're going to be all that effective. And I think that that's the call to action there, is that we need a better framework to have these types of conversations that's sensitive to discussing people and their bodies.
Yeah, and once we have those frameworks set up, peer education would be amazing, because that's where all the kids get their information from their friends.
They get their info from their friends. Yes. I tell people all the time, I am almost sure that my tween is learning more from her BFFs than me. Yeah. Because it's a trust and a comfort thing. After 12, 13 years old, when it comes to your kids, you're just this old gray-haired lady in a rocking chair, right? But her friends are the best thing going. So yeah. And
they're cool, they're hip, they know what's going on. So I'm gonna trust you.
And everybody now has a magic phone. So I mean, like they could just be like, Mom, I don't think you know what you're talking about, and then just Google it.
Let me Google it. Oh, my kids do that to me all the time. So we have a few comments here. I think it's some H.A.S people on here. Her name is Mel. Says hi everyone. And then Oz Khalid. I work with the best team. Thank you, everyone. This is such a great discussion. So if you're just joining us, I am on Zoom with H.A.S today, Healthcare Alternative Systems, and they're talking about a new initiative to kind of implement some more Spanish-speaking services for their harm reduction services. Frida, talk to us in Spanish. It's only right. I don't know what to tell you.
So I can definitely throw our information and throw our contact out there, just because we do want to keep building more partnerships. We want to see where people, what organizations are up to too as well. Information, how we can help them. So it's all about working together. It will always get us further. So our contact information is, so for my email, it's fenriquez@hascares.com, which is FENRIQUEZ@hascares.org. So sorry about that. And my phone number is 312-404-6542. And I can say it in Spanish.
Go, I'm excited.
Thank you. Buenas, all right, buenas tardes a todos. So, nosotros somos de H.A.S. Estamos con una organización que se llama Healthcare Alternative Systems. Nuestra parte y mi título es reducción de daños. Y eso significa es cómo podemos encontrar a personas en donde están y ayudarlos. Y son de diferentes maneras. Hacemos entrenamientos sobre dosis de opioides y cómo usar naloxona. Y nos pueden contactar a mí por correo a fenriquez@hascares.org o por teléfono me pueden llamar al 312-404-6542.
Lovely. Did you guys hear that out there? You do work with the best team, Oz. You do.
Oh.
That was impressive. Thank you so much. I think one thing about growing up, and this is definitely a Black thing, all right?
Mm-hmm.
One thing about growing up, even in grade school and in high school when you learn Spanish, you don't learn it the way that obviously the native language, the way that you guys know it. I'm just laughing at how I would have sounded just trying to say what you just said.
It would have been great though.
Yes,
Any try is amazing.
Talk to me about what it's like working at H.A.S. It seems like you guys have a ball there. What's it like?
So this program in particular is rather new to H.A.S. And I consider myself extremely lucky, working in this with this particular type of position. We definitely have a lot of, because it's Frida and me. We are a department of 2 people. So
wow, really?
Yeah. So we're doing it all, and in that sense, we have the ability to kind of make our own schedule, but also be where we think we need to be, and that absolutely comes from the support of our leadership at H.A.S, which has recognized that, hey, you guys know what you're doing. We need to make sure that you are able to do it. So I found that to be, really, really crucial to the work that we've been able to do so far.
That's wonderful.
And I just joined the team, but I'm really, really happy. There's just so many things. We came in, hit the ground running, and I'm really excited to see where this goes.
That's so cool, guys. COVID's got the world in a way. It's really been some tough months. Yeah. It does not surprise me, honestly, that harm reduction and overdose have went on the rise. It makes sense.
Yeah, and actually, I kind of want to speak to that a little bit too. It's like COVID is really hard, right? So it's been really isolating, but it's also just, I think, like, I don't want to discount or forget to mention just like how for people who do, for all of us, it's just added stress. And I think that especially when you might have a substance use dependence or use drugs, it just becomes that much harder, especially if your supply runs out, but also just to kind of get through that added stress.
Yeah.
So I think that is also a factor of why we might be seeing more additional or just more ODs.
Yeah, it makes total good sense. Are city officials and community leaders, are they recognizing this as an issue in this moment? And if so, in what way? Well, we know LaShawn K. Ford is, our Illinois State Rep, the convener of this task force. Hey, Rep. Ford.
Yeah, we know that Rep. Ford's doing a great job.
He's doing a great job.
Yeah. I think Mayor Lightfoot's administration has come out and recognized, and I've heard through the grapevine that she was pretty concerned and upset with the overdose rates. So, and I correct me if I'm wrong, Frida or V, but I'm pretty sure she's put some or allocated some effort or money into doing more work out on the street to try to combat the overdose rates. I'm pretty sure that's right, but
he's been putting funding together under the CARES Act, and just recently, I think, unveiled $11 million for healthcare in Auburn, Gresham, and North Lawndale. So she's going there. I think specifically pinpointing one issue is tough because, like Frida said, there's so many.
If Mayor Lightfoot wants to come on and talk to us about it, I would love to have that conversation, Mayor Lightfoot.
Ain't she, Lori? So what do you think about the city officials and leaders' response, Frida? Now that you're in H.A.S and you're kind of in the field, what are you thinking about the way your community is supporting this?
Yeah, definitely still, well, like everyone with COVID, we're responding as things goes, and we the data or the information when it gets to us, it can be very different. I know when we received the alert of unfortunately how many overdoses have happened within the last couple months, and their reaction is really going into hospitals and training people on naloxone use and also on how to care for their patients after an OD, which is really, really important, which is something that when people go through an OD and they're administered naloxone, they can go through intense withdrawals. So what happens and how they're cared for when they are in the care of a hospital is really, really important. So we did see that they're implementing some things and a lot of training for hospitals so that they can respond correctly, which again, is really, really important on how they're taken care of.
Yeah, that's good to know.
And we certainly need, not to say that we don't need more resources. We absolutely need more resources. We need more people who can help us do this work. We need partnerships. We need to exist in those hospital systems. Like we need it all and then some. So
absolutely. Well, that is definitely the premise of the task force. And I'm sure that's exactly why you all are a part of it. The task force being that group of people and those individuals in the industry to support each group through this. It's been different, to say the very least. COVID has been a storm in this country, and specifically in this city, I think has taught us a lot, mainly about the areas in this city that we're neglecting. Frida, can you talk to me outside of the opioid epidemic? Can you talk to me about the neglect in the Latinx community that you've seen over just these last few months during COVID?
Where do we start?
Where do you start, right? I know.
There's a lot of things, and we can start with jobs. We can start with the type of jobs that people do, and how it's displaced a lot of people, and how they're being asked right now to return to work, and just all of the things that will happen when they're back to work, and if already they're back to work, health problems that they might have, and if government still hasn't made up their mind on how they're going to be helping people, or if they're going to be doing a lot of the extra help that ended today or last week. So so there's just a lot of things that unfortunately people have to deal with. So the stress, the anxiety, and just the buildup of where is the help? Where can we get help? How can we talk to people when we need extra information? So Billy, I know I'm connected to a lot of Hispanic organizations just personally, and they're doing really great at sending emails, hey, this is an extra initiative that's being done. There's money provided here. Please share it. And I have friends that are sharing a lot of great information. But again, it's just word of mouth, and it's by people. It's definitely something that has been translated.
We are the movement.
When it should be larger. It should be getting to a lot more people. So there's just so many things that unfortunately people are going through at the moment because of COVID, and it keeps getting harder for people on so many aspects.
The jobs especially. That's a great point. So buzzwords in the African American community that has claimed to make us so much more vulnerable to COVID is this idea of pre-existing conditions, right? So Black folks, between diabetes and different levels of cancer and hypertension, we are generationally and genetically very vulnerable to the coronavirus. Can you talk to me a little bit about any vulnerabilities and conditions that may make the Latinx community vulnerable?
Yeah, so definitely access to care it can be really, really hard for some people, and unfortunately a lot of us know that we don't get care until we have to, when it's the worst time, because
that's insane to think about. You have to be pushed into healthcare.
And there's so many reasons. There's might not have healthcare coverage and might not be able to pay for all the bills that come right after that. So definitely, again, there's just layer upon layer upon layer that people have to weigh out. Will I go into debt, or will I just have to keep suffering in silence? And yeah, so it's happening in so many ways, and it just varies by community. So yeah, it's
someone
very
on our thread said, Maria Gonzalez, thanks for joining us. She said it's a lot of anxiety, lots of anxiety in the Latinx community. Can you talk about that a little bit?
Yeah, it's the unknown, which can be applied to everyone. It's like, are we going to be able to go to work? Are our children going to be able to go back to school in a safe way? If they do go back to school and they're mandated, or if they don't have to, will they be bringing it back? Where unfortunately, as we know, a lot of households, it's just not one generation in that household. It's going to be mom and pop maybe, or it might be grandparents, it might be a sibling with their kids, and there's just, because housing is another big problem that we have in Chicago, and in a lot of the Hispanic Latinx population, is that because there's a lot of gentrification going on, and people are being moved out, they can't afford the places, they have to go live with family. So again, the exposure, if one person in that household now has to go out and work, bringing it back home, it's really scary, because your 70-year-old or 90-year-old grandparent might be exposed to that, or someone in the house has asthma. So it's just, like they mentioned, the anxiety, and that, who knows, what can we do? Are we giving the proper information to keep not only ourselves but our families healthy?
So John, to kind of wrap this up, one thing that I remember learning from you and Maggie actually over at H.A.S is this idea of holistic care when it comes to harm reduction. Can you tell our viewers what that means and how H.A.S is achieving that?
Yeah, so the idea of holistic care is looking at the person in entirety, right? So let's take an example of a person who uses drugs. Most often when they try to engage in healthcare, and I mean, there's a million different examples, but they try to engage in healthcare and constantly are just described as a drug user, right? So, and no other aspect of their personhood or their humanity is addressed.
True.
Yeah, the social determinants of health that are associated with those things, right? Like what's their mental health? What have they experienced trauma? Do they have access to good food or nutrition? And all of these things really kind of they can add up, and they're really important to a person's overall health. So when we say holistic health, we are trying to reach the whole picture, right? The entire picture of the person, and really try to provide services and resources that are that are robust and can address all of those things.
It's not an idea of just giving you answers to get off of this drug or wean yourself off. Right?
Absolutely, right? And like we were saying earlier, drug use is so complicated, right? Sure. And there could be so many underlying things that are present in why a person uses drugs. And if you're just engaging with that person and saying, oh, well, stop using drugs, you're getting such a snippet of the situation, and you're setting that person up, in my opinion, up for failure. Right. So if we kind of tackle it from this more robust and holistic sense, then we might set them up for success, or at least a better chance for success, and whatever that success is defined for them.
So before we allow Frida to close us out in Spanish, John, can you please let everyone know how they can follow up with H.A.S, your website, any phone numbers or anything they need to know to follow up?
Yeah, I think our website is hascares.org, and people can, of course, reach out to me at my email, which is jwerning@hascares.org. And then I have to grab my business card because I always forget my number. You can call or text me at 312-468-2347. If you need harm reduction information or education, we can provide that. If you need Naloxone. We work with Chicago Recovery Alliance to distribute naloxone to vulnerable
HCRA,
populations.
we love you.
So please, connect us with those. We will do deliveries if people need naloxone, and we'll work with people to make sure that it's safe. If you want us to wipe down the kits or whatever, we'll work with you. And then if you need training, if you or your staff or your family members or your friends or whoever you think might need that training, we will train them. And the best part about, I think, this program is that we are not bound by any Chicago restrictions. Our jurisdiction is the city of Chicago. So
that's great.
From the absolute northmost points to the absolute southmost points, we will go anywhere. So
that's great. I don't think I've ever known that. That's amazing. Yeah, because some folks will say, oh, these zip codes or between these counties, which is also a barrier. I think that
a huge barrier for people accessing services and getting this information. And we know that there's a saturation of services in, like, let's say the north side of Chicago, and the west and south are just overlooked consistently. So it's one of the best parts of the program. We can go to where you are. We can meet you where you're at. So please get in contact with us.
That's awesome. We have a question from the audience before we close. Maria Gonzalez says, does anyone know if you are seeing an increase in relapse? Ooh.
Are we seeing an increase in relapse?
Yeah.
I think that probably. I don't know. I don't have the exact data, I think, on hand, but knowing the OD rates, I would probably put my money on yes.
That makes a lot of sense.
Unfortunately, because of COVID and with everything going on, people's support systems, in many different ways and forms, has been altered. And maybe they can't see their friends, the people that they used to see, or close family members, or the people that they used to get services from is no longer available, or it's limited, or it's not in person. Little things like that, but that might be something to think about.
Yeah. Wow. And also, I just, we also see a lot of relapse when people are in services that aren't, necessarily the service that they need to be in at that time, right?
Interesting point, John.
So when we say access to services, I think, especially from a harm reduction perspective, we need to be thinking about access to appropriate services. So they might be in a 28-day program, but that might be inadequate care for what their substance use is, right? So they might need a therapist, an ongoing therapist. They might, like Frida said, they might need housing. So if you are in an inadequate service, it's very likely you're going to leave that service and then relapse or experience relapse.
That makes a lot of sense. Well, you guys are doing great work, and I know that during the pandemic, it's got to be even more interesting and challenging.
It's grim.
I'm sure. That's a great word. I'm going to use that one on Monday morning. Yeah. It's grim. Great work, Frida and John. I'm just really excited to know that there is some attention being paid to the Latinx community. As I'm writing about the Black culture, it is definitely one of those subtopics that's coming up about, don't forget that there's another nationality that has these struggles and that are disproportionately being impacted, and definitely worth talking about and saving. So you guys are doing great work. Frida, close us out. Can you tell us in Spanish that Narcan saves lives?
Naloxone salva vidas.
Narcan saves lives, guys. And please reach out to H.A.S, HAScares.org. You have two very great people in harm reduction who's doing the work. Even when it's grim, they're dedicated. We thank you guys so much for your support of the task force. And the task force is here for you, and I know you know that already. And thank you so much to everyone that gave such great questions. We had really good questions come in tonight. We appreciate that.
Thanks, everybody, for allowing us to be on this platform. Really appreciate the time, V.
Absolutely. You guys got it. And this conversation will not end here. You'll be hearing a lot more from H.A.S and the task force about Spanish-speaking services for harm reduction. Happy Friday night, guys.
Yeah, happy Friday night.
Pour your drink now. I'm done. And enjoy your evenings. Thank you guys so much. This was perfect.
Yeah, it was a pleasure.
Please share out the video if you joined us. We'll definitely share it out more than today. And I'll keep you posted on talking more about this topic.
Thank you.
Great.
Thank you. You guys have a great night. Thanks, Facebook.
Right.
Night.